At 40, life is just beginning. A familiar phrase from an old movie. Don't you agree? Or does it feel to you that your skin has become drier and more flaky, your hair is thinning, your energy is gone, and you wake up in the morning feeling as if you never went to sleep? These issues can also be addressed. Let's take a closer look together. I am a gynecologist and surgeon. Today we will talk about how a woman's life changes after the age of 40. I am still quite young, only 52. However, there is one aspect that may not be unpleasant exactly, but somewhat concerning: the internal changes that occur in a woman's body during this period, when menopause approaches. There are also some external changes related to appearance and beauty. In reality, the conflict is not with my current state, but with certain anxieties about what lies ahead. I have never personally observed the aging process before, and that uncertainty can be unsettling. From a medical perspective, women over 40 experience a number of changes that are completely natural, though often distressing. In fact, these changes begin earlier, around the age of 35 to 37. The key event during this period is the gradual depletion of ovarian reserve, the supply of eggs, which leads to hormonal changes. How can you tell that these changes have begun? A menstrual cycle that was previously 28 to 30 days may suddenly shorten to 26, 24, or even 21 days. This can be the first sign that the ovaries are transitioning into a different mode of function. There is a common belief that estrogen, the primary female sex hormone, decreases during this time. Estrogen is produced in the ovaries, but it is not the only hormone they produce. Progesterone is also synthesized there. The balance between estrogen and progesterone largely determines a woman's well-being and influences her menstrual cycle. The mechanism that once functioned like clockwork begins to falter. Many women wonder whether they should undergo laboratory testing to better understand what is happening in their bodies. To address this question, I would like to turn to my colleague, an endocrinologist, to explain what happens to female hormones during this period. Why is male behavior often described as predictable, while female behavior is seen as less predictable? Because throughout a woman's life, her hormone levels constantly fluctuate. When estrogen levels decline, a woman cannot help but feel emotional changes. When such patients come to an endocrinology center, we carefully evaluate laboratory parameters that fall outside reference ranges. Of course, we assess estrogen and progesterone levels, and sometimes other hormones as well. However, testing should only be performed after consultation with a physician, not before. This is very important. A woman's ovarian reserve is her gold reserve. At birth, a girl has approximately 1 to 2 million eggs in her ovaries. By the onset of menstruation, only about 300,000 to 400,000 remain. Let me illustrate how the ovaries function under normal circumstances. Imagine this is the ovary, and the small yellow spheres represent eggs. At birth, there are many eggs, and over time they are gradually depleted. Ovulation requires stimulation by specific hormones. One such hormone is follicle-stimulating hormone, FSH. FSH stimulates the maturation and release of an egg. With age, particularly after 40, the number of eggs decreases significantly. As a result, FSH levels rise sharply, forcing the ovaries to work at their maximum capacity and utilize the remaining eggs. It is important to remember that the final menstrual period does not mean the ovaries have completely stopped functioning. Even after menopause, some eggs remain and may occasionally ovulate spontaneously, particularly within the first 1 to 2 years. Such spontaneous ovulation can sometimes result in an unintended pregnancy in women over 50. After 40, many women experience disturbances in menstrual cycle regulation. The first function typically lost is the ability to conceive. Cycles may become anovulatory, meaning no egg matures. These cycles are often accompanied by delayed menstruation, irregular bleeding, and cycle disruptions. Additionally, with age, women may develop gynecological conditions such as endometriosis, polyps, or uterine fibroids. Not only do the ovaries function cyclically, but the uterus does as well. Each month, the endometrium, the uterine lining, thickens and then sheds. However, if hormonal imbalance or endometrial pathology is present, the lining may not shed properly and instead accumulates layer upon layer. This condition is known as endometrial hyperplasia. It is concerning for two reasons. First, it increases the risk of precancerous or cancerous changes. Second, when bleeding does occur, it may be excessively heavy and require surgical gynecological intervention. If a woman notices that her periods have become heavier, especially if accompanied by irregular cycles, fatigue, hair loss, brittle hair, dry skin, or even depressive symptoms, this may indicate anemia due to excessive blood loss. In such cases, I strongly recommend consulting a gynecologist. Another important aspect after 40 is regular blood testing, including biochemical analyses. Metabolic changes begin during this period, and early signs may indicate future development of diabetes, atherosclerosis, anemia, or gout. A comprehensive blood test can detect a wide range of conditions and guide further diagnostic evaluation if necessary. Let us also consider the cervix, the lower part of the uterus. Human papillomavirus (HPV) infection is the primary risk factor for cervical cancer. Therefore, women over 40 should undergo high-risk HPV testing and cytological screening, also known as a pap test. These tests are performed during a routine gynecological examination and allow for early detection of precancerous and cancerous changes. In addition to cervical screening, breast examinations are essential. Evaluation may include ultrasound, mammography, or MRI, depending on individual circumstances. Many patients come to me saying, "I felt something, I noticed discharge," or "my nipple has retracted." These symptoms should not be ignored. At least once a month, a woman should carefully examine her breasts, checking for skin changes, retraction, bulging, asymmetry, changes in skin color, prominent veins, discharge, or nipple inversion. Approximately 25% of patients report nipple discharge during consultations. This symptom always warrants careful evaluation. Especially concerning are bloody discharges, brown, dark, or serous amber-colored secretions. These types of discharge require particular attention. They are most often associated with intraductal growths. This may be a benign intraductal papilloma or, in some cases, intraductal cancer. Ductography is a diagnostic technique that allows us to examine the inner lining of the milk ducts. These ducts are extremely thin, less than 2 mm in diameter, and are not visible on standard imaging. With artificial contrast enhancement, we can clearly assess the internal walls of the ducts and detect even small growths. Why is this important? Because if we detect very small changes, less than 1 mm, we can perform a minimally invasive, organ-preserving procedure. This allows us to prevent the potential development of cancer at a very early stage. It is well known that in 70 to 80% of cases, breast cancer originates in the ducts. Therefore, this symptom is highly significant, and this diagnostic method is effective in approximately 96% of cases. The procedure is performed on an outpatient basis and takes about 20 minutes, after which the patient can go home. There are also several other diagnostic methods that women should be aware of. They should not be afraid to visit a physician and should remember that early detection allows for outpatient treatment or minimally invasive surgery, even in cases of serious pathological changes. For example, during a biopsy procedure, the formation is locally anesthetized. You may hear a clicking sound, do not be alarmed. The needle passes through the lesion, and we monitor its position at every moment within the breast tissue. Then the needle is removed along with the tissue sample. Previously, this procedure required a diagnostic surgery under general anesthesia, with a large incision and a prolonged waiting period for results. Today, it can be completed in 10 to 15 minutes. Breast cancer treatment has fundamentally changed due to the early detection of so-called non-palpable cancer, tumors that cannot be felt and do not yet produce clinical symptoms. These may include microcalcifications as small as 50 microns, small tumor nodules measuring 3 to 5 millimeters, or subtle structural distortions. All of these can now be effectively treated. A new field called oncoplastic surgery has developed, allowing for organ-preserving procedures that maintain both the breast and its aesthetic appearance, while improving life expectancy and quality of life. Women over 40 often ask which laboratory tests are essential for monitoring their health. I recommend that all women undergo testing for vitamin D, ferritin, thyroid hormones, and blood glucose levels. These tests are especially important for women who notice changes in their well-being. For example, if before 40 a woman maintained a stable weight and figure, but later begins to gain weight without changing her diet, this may signal metabolic changes. With age and the gradual decline of ovarian function, weight gain commonly occurs. Unfortunately, it often follows an unfavorable pattern, leading to visceral obesity. What does this mean? If waist circumference exceeds 80 centimeters, there is a high risk of metabolic disorders. If weight gain continues despite a normal or even active lifestyle, this is a reason to consult a gynecologist. We can help identify hidden metabolic disturbances, prevent further weight gain, and reduce the risk of conditions such as diabetes, atherosclerosis, hypertension, breast cancer, and endometrial cancer. Metabolism slows significantly after 40. Therefore, it is important not simply to reduce calories, but to balance nutrition properly. For example, compare 2 meal portions. In the second portion, there is less cereal and a smaller portion of meat, but more vegetables. The balance of proteins, fats, and carbohydrates is much healthier. Avoid long breaks between meals. Bring several small containers of food to work and eat every 2 to 3 hours. This helps prevent overeating and reduces total daily caloric intake. Women should generally consume 1,500 to 2,000 kilocalories per day. Reducing intake below 1,500 can cause significant stress for the body. Under stress, cortisol levels increase, promoting fat accumulation in typical female problem areas. Lack of sleep also increases cortisol production. Therefore, if you wish to lose weight, normalize your sleep first. It is not necessary to follow extreme diets. You can eat the foods you enjoy, but in small portions and more frequently. Pleasure is an important part of life, and there is no need for excessive deprivation. If you are not athletic and do not enjoy jogging, try to remain active in daily life, cleaning, cooking, household tasks. These activities also require considerable energy expenditure. Sex hormones influence all tissues in the body. In younger women, the vaginal mucosa is well hydrated and elastic, which is important for intimate life. With age and declining hormone levels, the mucosa becomes thinner, drier, and more susceptible to injury. This issue can be addressed by consulting a gynecologist. There are many options available today, including moisturizers and local hormonal treatments. These include estrogen-based creams, capsules, or suppositories that act locally on the urogenital tract and improve the condition of vaginal and urinary tissues. Sex hormones also affect the ligaments that support the uterus. Normally, the uterus is positioned in the center of the pelvis, between the bladder and the rectum. It is held in place by ligaments at 3 levels. With age and declining hormone levels, these ligaments weaken. If this is combined with childbirth-related trauma, when muscles and ligaments were stretched or damaged, it can lead to uterine prolapse or prolapse of the vaginal walls. In some cases, women may only experience discomfort during intercourse. In more severe cases, the uterus may descend completely beyond the vaginal opening. In such cases, of course, the help of a gynecologic surgeon may be necessary. However, if the prolapse is minimal, simple exercises can help manage the condition. I personally do my daily exercises and warm-up routine, nothing excessive. I walk a lot. About 5 years ago, I told myself that walking would be beneficial, and since then I have been consistent. On average, I walk about 5 to 8 kilometers per day. Maintaining health can also include fitness activities or swimming, when you have the desire and opportunity. For me personally, it is better to go swimming at night than to sleep. Swimming and water are very important to me. When we discuss uterine and vaginal wall prolapse, we often talk about Kegel exercises. Kegel exercises are a series of movements designed to strengthen the pelvic floor muscles. They can be performed independently by contracting and relaxing the muscles several times a day, or by using special weighted devices to increase resistance and improve effectiveness. It is important not only to lift the pelvic organs upward but also to build a proper muscular support framework of the pelvic floor, because this muscular structure ensures normal intimate function. Now let us address a very interesting and intimate topic as sex after 40. There is a common myth that after 40, sex no longer plays the same role in a woman's life as it did earlier. However, discussions on the internet suggest otherwise. So, is there sex after 40? And why can intimate life at this age sometimes become even more fulfilling than in youth? Both men and women have male sex hormones, testosterone, and female sex hormones, estrogen, in their bodies. Naturally, testosterone predominates in men and estrogen in women. After 40, estrogen levels gradually decline. At some point, because testosterone levels do not decrease as rapidly, the relative influence of male hormones becomes more pronounced. Sex hormones are directly related to libido and sexual satisfaction. When the relative concentration of testosterone becomes more significant, some women may feel more confident, more open to new relationships, and may experience increased sexual desire and satisfaction. This physiological shift may explain the popular saying that life and vitality return in midlife. Regular sexual activity is also associated with longevity. Studies suggest that individuals who engage in sexual activity at least once per week have a significantly higher likelihood of living to older age. Emotionally, many women say that although they understand they are over 50, internally they may still feel 35. There may be moments of awkwardness, but often there is no real conflict, rather, a sense of maturity combined with youthful energy. Many women report that after 40 they develop greater self-respect and emotional balance. They feel more confident, more comfortable with their character, and better able to interact with others. However, it is also true that hormonal changes can affect mood. I especially want to address men. Changes in behavior are often linked to declining ovarian function. Women may experience mood swings, sleep disturbances, hot flashes, night sweats, and increased irritability. In such cases, life can feel overwhelming. When these symptoms first appear, it is important to consult a gynecologist. Interestingly, some studies suggest that women with moderate body fat distribution in the hips and thighs may tolerate this transition more easily, as adipose tissue can produce small amounts of estrogen. On average, regardless of nationality or country, menopause occurs around age 51 to 52. This age may vary due to factors such as radiation therapy or ovarian surgery. It is not always possible to predict menopause timing based solely on a mother's experience, since genetics are inherited from both parents. If menstruation ends before age 45, this requires prompt medical evaluation. Early ovarian failure is associated with increased risks of conditions such as diabetes, atherosclerosis, osteoporosis, fractures, Parkinson's disease, dementia, depression, and other age-related disorders. In such cases, a gynecologist may order specialized tests to evaluate ovarian reserve and hormone levels. If hormone deficiency is identified, appropriate therapy can be prescribed to maintain quality of life, health, and longevity. How can we encourage women to seek medical evaluation? First, no one should be forced or frightened. Fear is not an effective motivator. Instead, women should understand that there are certain life stages when medical evaluation is simply necessary, when preparing for pregnancy and when entering perimenopause. After that, an annual checkup is usually sufficient. This is not overly burdensome and can make a significant difference. For many women, this stage of life becomes one of the most fulfilling. There is experience, stability, self-respect, and independence. Children are grown, life experience has accumulated, and there is confidence and maturity. In summary, what defines a healthy woman at 40? A healthy woman is one who exercises regularly, eats a balanced diet, maintains an active social and personal life, including a satisfying intimate life, and does not experience significant health complaints. And if something does concern you, do not lose hope. In most cases, these issues are manageable and treatable with timely medical care.